We also have Mr. J.V. Prasad Rao. Mr. Rao, as a former health secretary, what do you see as India's main challenge in the road ahead to attain Sampoorna Swasth?
I think the road to Sampoorna Swasth lies in keeping people at the center of the response. See, it should be people-centered health, not facility-centered health. Unfortunately, even until now, when we talk about health centers, hospitals, doctors, nurses, etc. But if you have to put the people at the center, and if you talk about universal health coverage as your objective, we should see how we can reach the facility to the last mile, to the people who are deprived, to the people who are marginalized, who are far away in the jungles, and also who are stigmatized and criminalized, like the gay population, the men who have sex with men, the sex workers, and so many others. And today, as Amitabh ji rightly pointed out, we say that we have extended a number of facilities, but where is the monitoring? Do we really know that these facilities are actually being extended to them? This is where I think community-led monitoring is very, very important. And this is something which has been successfully done in the case of HIV way back, because wherever the communities are active, you can have very good monitoring of the program. And unfortunately, in COVID, we didn't involve the communities the way we should normally when there is such a huge emergency which has come in. So for me, I think reaching the facilities to the most deprived people and putting access before coverage. I think coverage is very easy to say. I have made 90% coverage, but the 10% who are left out are the most needy always. So I think it's always better to talk about access, and reaching health services to the last mile is the most important thing. Second is, we have to bring in the programs into some sort of a convergence. Today, we reach a number of services like silo programs. You have TB, you have HIV, you have malaria, you have leprosy, so many programs, and also reproductive health. And we have one common healthcare system. But all of them, they have their own budgetary streams, they have their own way of monitoring, reaching services, etc. And whatever efforts have been made to bring in such number of convergence among these programs has not been very successful. For the first time, I think we are making an attempt now. I find that the WHO has taken the lead, and the countries in this region, Southeast Asia region, have committed that they will bring HIV, hepatitis B and C, and sexually transmitted infections into one common system of governance, which is a good step. And I would say even TB should come under that. So if you bring some of these programs under a common governance structure, and if you see that the delivery systems are integrated, so that the same person doesn't have to come again and again, once for TB, once for HIV, once for malaria, and things like that, then it becomes truly people-centered. And one more thing I want to add, thanks to COVID, even the testing mechanism that we have for various diseases, now it can be very nicely integrated, because the RT-PCR system which has come, earlier it used to be very costly and we used to have just a few centers in the entire country. Today, almost every primary health center in many cases have RT-PCR facilities. You can mount all the testing, whether it is for TB or for malaria or anything, on the RT-PCR platform. If you can bring in an integration into the testing services, you can see that the same person need not come again and again for different testing programs. So these are the ways in which you have to bring in integration of services. I think that for me is the true way you can bring in universal health coverage to the people of this country.